Hi, good day to you. This is Dr. Amihan, your humble servant in health in a northern part of Antique. How are you? I hope that you're in good hands at the comfort of your home. We will discuss now a very important topic. Please join me. This is about the use of statins. Like for example, your simvastatin, your rosuvastatin, and your atorvastatin, of which many of us are taking it together with other medications. Okay, so this is very important since our patient is always asking if you give this medication. They will always ask, Doc, is the medicines will not react with other medicines that I am taking for hypertension or for diabetes or for other diseases. Okay, so we will discuss now. Please join us as what I've said. Okay, wait. Here. So, a few minutes ago, I had a patient with hypertension and diabetes, and he also has what we call modest elevation of the bad cholesterol and the total cholesterol. Since that patient is diabetic, there is also a moderate elevation of the triglycerides level. So he is asking now if it will not interact with other medications that she is taking due to diabetes and hypertension. And the patient is also asking with regards to the side effects of the medicines. So I told him, if I will give you and prescribe you the medicines, statins in a form of simvastatin or rosuvastatin or atorvastatin, the common side effects are body pains, body pains, fatigue, sometimes headache, and I also had one patient before that suffers bloody urine. Okay, so that patient took for almost a week, and after 5 days, that patient had a bloody urine, and after stopping taking it, after 2 days of stopping the medications, the bloody urine improves until that patient gets well. So we stopped the giving of atorvastatin. Now, one of the common, I think, observed side effect of statins in patients, in our patients in the clinic, is they had a modest elevation of blood sugar. Okay? Most of our patients are diabetic, and yet if they took statins, some of them, or a percentage of them, will have an increased blood sugar. So, what is the reason why we still give that medicines? The statins, the atorvastatin, the simvastatin, and rosuvastatin, when in fact it will increase the blood sugar. The increase of the blood sugar is, as what I've said, is only a little and moderate increase, and it is not all of our patients had elevated blood sugar if they took statins. Studies have shown in 2008 and 2010 that it only a portion of 9% of them, of patients took statins, will have a little or moderate increase of the blood sugar. Anyway, if the patient is hypertensive with good control of the blood pressure and if they are diabetic with a good control due to the taking of medicines, anti-diabetic medicines, plus the diet and exercise, the blood sugar, I think, will not elevate that much. Okay? So it is not only the medicines. We cannot only rely with the medicines to decrease the blood sugar. You can decrease your blood sugar by dieting and exercise, and by taking your anti-diabetic meds. So, no problem with that if you took simvastatin. Plus, the effect of taking statins outweighs the risk, because statins, the function of it is to decrease or to prevent the production of cholesterol in the liver. It inhibits an enzymes, or it blocks the function of a liver enzymes that will produce cholesterol. And we all know that if we have elevated cholesterol or blood cholesterols, there is a big chance that fats or fatty substance will deposit in our blood vessels or arteries, and it will cause clogging and inflammation, which will produce an increased risk of stroke and cardiovascular events such as your heart attack or acute myocardial infarction. So the side effect of statins outweighs the risk, okay, of developing elevated, moderate, or a little increase of your blood sugar versus the effect of having a stroke or a heart attack. So that is the reason why doctors still gave the medicines, because it outweighs the risk. The statins offer more benefits than the side effect. So now you know. Okay? So this is Dr. Amihan, your humble servant in health. I hope that our talk today offered some good medical information to you. Our talk is not a medical advice. You have to visit your physicians for medical problems. Okay? So as what I've said, this is Dr. Amihan, your humble servant in health in the northern part of Antique, wishing you the best of everything. Bye. See ya.